you for the invitation. And I'm going to go through a PowerPoint presentation, but it's much shorter than the amount of time that we have, so that we have plenty of time to have discussion and have your questions. I think that is likely as important, if not more important, than the slides that I'll share. So the first thing to say is that you'll notice on my opening slide that I have my Twitter and Instagram handles on the first page here. And that is because we are at a turning point in the field of exercise and cancer, where we're really working to help people to see that exercise is something they should be doing before, during, and after their cancer treatment and recovery from their cancer treatment. The image that most people have in their heads, and what the media portrays about who cancer patients and survivors are, is much more infirm than the truth. You can and you should be as physically active as you're able to be, and it will be very good for you. And so I invite you to join me on social media, where I post regularly about benefits of physical activity for people living with and beyond cancer. So let's see if I can get my slides to go forward. There we go. So just as an overview, I'm just going to do two sections here. One is the why you should exercise and what the evidence base tells us. The second is the inspiration section, and that is the section of what is possible. And so I have some information about inspiration from other patients and survivors, ranging from Olympians to everyday folk, and then a closing. So just so that you all know, this is not something that I just sort of cooked up in my basement. This is a field that has been growing for a very long time. In fact, the first human clinical trials that were done to show that exercise was safe and beneficial in cancer patients were done in the 1980s at Ohio State University by two nursing researchers. And in 1996, a review was published about the field of exercise and cancer, and they found 4 trials. So not a whole lot of progress by that point. But what you can start to see is that by 2010, you see the green arrow pointing down. That was when we held the first American College of Sports Medicine roundtable. And at that point, there were about 225 trials that had been completed in the field of exercise oncology. In the intervening years between that and the second roundtable, which would have occurred in 2018, there was an exponential rise in the number of randomized controlled trials, high quality clinical trials that were done in the field of exercise oncology. If you were to go into the place where all scientists go to search for the literature, the scientific literature, it's called PubMed, and you were to put in cancer and exercise and clinical trials, you would see that there have now been thousands of clinical trials that have documented the safety and efficacy of exercise during and after cancer treatment. So as a result of that, as has been mentioned, in 2018, the American College of Sports Medicine chose to hold an international multidisciplinary roundtable on the topic of exercise and cancer prevention and control. We held it in San Francisco back in the days when we traveled. Remember that? And I was very, very delighted and honored to co-chair this meeting with my colleague, Chuck Matthews, who is from the National Cancer Institute. What you can also see on this slide is that we had a number of partner organizations in the room. We did this on purpose. We wanted to make sure that those of us that are exercise physiologists weren't just talking to each other. We wanted to make sure that we had nurses in the room, surgeons in the room, medical oncologists, family practice docs, physical therapists, all of the various specialties that touch the patient, so that we could come to consensus as a group, as a multidisciplinary team, about what the state of the scientific evidence was about the benefits of exercise for people living with and beyond cancer. And so there were a number of papers that came out of this, and the one that I'm just going to focus on tonight and summarize for you tonight very briefly was very capably led by Kristen Campbell and Carrie Winter Stone and was called Exercise Guidelines for Cancer Survivors, a consensus statement from an international multidisciplinary roundtable. The idea behind this was to do a review of all of the different symptoms and side effects that occur for people as they're going through their cancer treatment and might linger and still occur after the end of cancer treatment. And to say, is it possible for us to prescribe exercise as precisely as we prescribe chemotherapy? Can we prescribe it not just, hey, go get some exercise, but I want you to do this 3 times a week at moderate intensity for 30 minutes, and I want you to do some brisk walking. Okay, so frequency, intensity, time, and type. That's the kind of specificity that we use, say, for chemotherapy. We don't tell people, hey, go get some chemotherapy, right? That's a silly idea. Instead, we tell them what drug they're going to get. We tell them how frequently we're going to give it to them. We tell them what the dose is that they're going to get. We tell them how long it's going to take for us to go through this round of chemotherapy. And they know what type of chemotherapy they're getting. So that's the specificity that we were looking for. And the other thing was we had to have some kind of rubric that would tell us whether or not there was sufficient evidence for us to draw that fit prescription to say how many times a week people should be exercising, what intensity, what type, and what time, how long they should do it. So the first thing to say is that we only included randomized controlled trials. And those are the gold standard for scientific evidence. And then we adapted a decision tree from the Dutch physical activity guidelines that basically said, if you don't have 5 studies in a particular area, you have no business drawing a fit prescription. So, for example, if we looked into chemotherapy-induced peripheral neuropathy, the tingling in hands and feet that can occur from some chemotherapies, if there weren't 5 studies on it, we stopped. We said, nope, we can't draw a fit prescription. But if there were at least 5 studies, and we showed in those 5 studies that there was some effect, that actually there was benefit to be gleaned, and it was statistically significant, then we looked at whether or not there was any kind of differences between the studies. That's called heterogeneity of effect. If we showed no heterogeneity, then we said this was strong evidence, and we said fit prescription, green, okay? We're sure about this. This is as strong as evidence as we're going to get. If, on the other hand, we said, well, there's some differences between study A and study B, but the later studies show us that there really is some benefit, then we said, okay, that's moderate level of evidence. Let's draw a fit prescription. So what did we conclude? We did a review of 16 different cancer health-related outcomes, different symptoms and side effects. And what we were able to conclude was that there was strong evidence for a fit prescription. In other words, our ability to say how often, how intensively, how much time you should spend, and what type of exercise would be helpful for anxiety, depressive symptoms, cancer-related fatigue, health-related quality of life, breast cancer-related lymphedema, and physical function. We showed that there was a moderate level of evidence for bone health outcomes, as well as for sleep, huge issue for many cancer patients and survivors. We were unable to draw a fit prescription for a whole host of issues that are important. This doesn't mean that exercise isn't helpful for these outcomes. What it means is that there have not been sufficient studies completed to date that would tell us whether or not exercise would be good for cardiotoxicity, chemotherapy-induced peripheral neuropathy, cognitive function, falls, nausea, pain, sexual function, and treatment tolerance. So stay tuned on those topics. So I'm not going to go through the evidence base for each one of the 8 that we can draw the fit prescription for, because it would take too long, and I think that your questions are more important. But I want to give you an example, just so that you know that, again, I'm not, going to my basement and cooking this up out of cloth. So the example that is most stunning is cancer-related fatigue. So we all know that the prevalence rate of cancer-related fatigue during chemotherapy is close to 100% for patients. So there have been over 200 randomized controlled trials that have tested the potential for exercise to improve cancer-related fatigue. It is the largest evidence area in the field of what we call exercise oncology. There have been so many studies that there are many, many different reviews and meta-analyses that have been done on this topic, including the one by George and Christy Kelly. But the study that I want to really point out to you that I think is the most telling of why you should be exercising if fatigue is ever an issue for you was published by Karen Mustian in 2017 in the journal JAMA Oncology. Karen and her colleagues pulled together all of the studies that they could find about exercise, all of the randomized controlled trials they could find about exercise and cancer-related fatigue. And they compared the effect size, which means the magnitude of the effect of the intervention for a variety of different types of interventions. And I want to point out to you that for exercise, which is the lowest row here, they showed that they found 69 studies that did exercise alone. And then the next column, WES, stands for weighted mean effect size. It was a 0.3. That's actually in the moderate category. And we'll just ignore the rest of the columns there for right now. But what I want to show you is they actually did a comparison of this to what if a drug were prescribed by a physician for cancer-related fatigue. They found 14 studies that looked at drugs to try to treat cancer-related fatigue. And what they found was that the weighted mean effect size was much smaller than for exercise, much smaller. In fact, it was not statistically significant. So what that comparison shows us is that there is not a drug on the market that is better for you for addressing your cancer-related fatigue than exercise. So there is an infographic that's available at the website that is noted here. And I just want to kind of summarize all of this for you. If I'm looking at these 8 cancer health related outcomes for which we decided or determined that there was sufficient evidence for a fit prescription, if I can summarize it for you, I can say that during treatment, the recommendation is 3 times a week, 30 to 60 minutes of moderate intensity aerobic activity, like brisk walking or bicycling or swimming. For some outcomes, there is additional benefit from doing resistance training twice weekly. And the outcomes for which the resistance training appears to be most important are lymphedema and bone health. So I'll answer any questions about that at the end, but I want to switch to what is possible. So this is exercise oncology in action. The first case study I want to present to you is Jolly. This is Bill Jolly. He is a remarkable guy. And you can see here in the picture at the top on the left, in spring 2011, he weighed 210 pounds. It had been 15 years since he exited the US Marine Corps. He was 40 years old. And a friend of his said, hey, let's go train for a triathlon. And in June of that year, he was exhausted after 5 laps in the pool, which didn't make any sense to him. He said to himself, I know I'm out of shape, but should I be this tired doing this little amount of exercise? In July that summer, he developed what felt like chest congestion. There was nothing significant on the chest CT, but the PCP prescribed albuterol for adult onset asthma. In August of that year, he was trying to do a workout that was a swim and run combination. And his friend said, damn, Jolly, I didn't know you had asthma. He was wheezing so bad, he felt like he had swallowed a whistle. In September of that year, the PCP ordered a second chest scan, saying, oh, it's probably nothing. You probably haven't, looks like you have an enlarged heart. Let's just get somebody else to take a look at it. And in October of that year, a radiologist recommended a CT, and he was diagnosed with stage 3 lymphoma. In December, that was confirmed with biopsy. And in January of 2012, he started 6 cycles of combined chemotherapy. That same month, he was at a major cancer institute. I will not name it, but he did ask, hey, where's the exercise program? I hear exercise is valuable for people going through cancer. And they said, exercise? They didn't really have anything, but they pointed him to the Leukemia Lymphoma Team and Training Program. And he signed up right away and decided to start training for an event with Team and Training. 5 months after chemotherapy, he ran the Marine Corps Marathon. In 2013, he did the Outer Banks Olympic Tri. In 2014, another Olympic Tri. 2018, a half marathon. He did have a relapse in 2016, a fourth year remission, and started oral targeted therapy. In January of 2017, he had this increasing fatigue, growing, significant, really sort of like a dark cloud closing in around him is the way that I've heard Jolly talk about it. He said, I felt myself going to a dark place and I didn't like it. I didn't want to work. I didn't want to talk to my wife or my kids. And after 4 days of increasing depression by the day, I told my wife at 10:30 at night, we lived in the South, that he had to go for a run. And 1 mile into the run, the fatigue and depression just vanished. He felt he could keep the fatigue and depression at bay as long as he exercised at least every other day. And he finally fulfilled his dream of completing an Ironman in October of 2017. So as of fall of 2019, this was Jolly's ideal training plan. This is someone who's living with recurrent lymphoma. So you can see all of the exercise that he's doing, 6 days a week, doing a lot of exercise. And then he sort of apologizes at the bottom, saying has a 21-year-old, a 17-year-old, and a 22-month-old girl, and another 5-month-old foster child, a busy career. He says, I almost always get Saturday and Sunday workouts in, but only 2 to 3 workouts during the week. I love the fact that he apologizes for this level of exercise. This makes me feel lazy. I exercise a lot. This is an awful lot of exercise. Jolly allows me to share his story as long as I share this slide in particular. He says, it's really important to teach people to listen to their body. This is the secret sauce in my book. This is the secret sauce. I need you all to hear me say that. Okay, I'm actually going to interrupt my talk for a second in order to talk about this because it's so important. If you drive your car every day and your car develops a new rattle, you know it because you've been driving your car every day. You know what your machine does, what it sounds like, how it functions, okay? Your body is your car. Your body is your instrument. If you work with it every day, if you do something with it every day, then the day that you get up and you think, oy vey, this is not going well today. This is really like, I feel like crazy different amount of tired, or, I feel a symptom that I'm not used to. There's a pain in this particular place. You know your body and your ability to report what's happening to your body to your care team is much better if you are paying attention to your body and using it on a daily basis. I'm not asking you to train like Jolly, but I am asking you to move enough to know if there's a new rattle in your engine, if you will. Okay, back to my talk. So if you listen to your body, if you train on a regular basis, you will know when something is off. And frankly, you'll probably know it before the lab tests will tell you that something's off. So if something feels off, don't ignore it. You do want to be quick to get help from allied health professionals, exercise, nutrition, psychology. You all are doing that now. ACEs, good job. Medicine and surgery are not the only tools to address cancer. We know that exercise can reduce or eliminate medication symptoms, and it also reduces recurrence of breast, prostate, and colon cancers. I'm happy to answer questions about that later. And most importantly, cancer often feels to people like it's something that happens to you, and the treatments are something that happen to you. And exercise is a way of reclaiming a little bit of control over your body and your life. I love that last one. All right, case study number 2 is Norma. Norma is a patient at Penn State, and she had metastatic breast cancer. She came to us at age 61. She had had compression fractures with diffuse metastatic tumors all over her vertebra. And she also was asthmatic. She had type 2 diabetes. She had controlled hypertension. She was obese. So there were a lot of chronic conditions going on. She walked in with a walker the first time that we saw her, and she looked like a question mark. She was completely hunched over. She had to take frequent breaks, even coming in the room, to sit down due to weakness in her legs. She had had a prior spinal surgery, and the surgeon had told her that she would mostly be bedridden for the rest of her life. We entered her into a trial called Nurse Amy, which is work that we still have ongoing at Penn State. And for this was a tablet-based supportive care program. And, it basically starts with a daily reminder, a welcome page with a friendly face saying hello and greeting the person, asking symptom questions, asking for step counts. And then there's an empathic response to the symptom questions. So if you say your symptoms are great, the picture goes like this, or the nurse claps and says, I'm so glad things are going well. If you're not doing well, the nurse's face looks more drawn. She says, oh, I'm so sorry, things are not going well. And then we offer an intervention based on what the symptom response was. There's an algorithm in the background to offer concordant, guideline-based intervention modules, including physical activity, cognitive behavioral therapy, mindfulness strategies, music, and psychoeducation. Once the intervention is done, then we're done. We end for the day, we say goodbye, and we end for the day. All of the information is dumped into a database. And if there are elevated symptoms, our team then communicates that through the electronic medical record to the clinician, and the clinician can then choose whether to allow the person to continue on with self-care for their symptoms or to step things up and have a pharmacologic intervention. We also did weekly navigator calls with these patients to check in and say, hey, it looks like you're not sleeping well. Can we talk about sleep hygiene or, whatever they needed at that time. By the end of our 3-month study, Norma was averaging 10,000 steps a day with her pedometer. She was able to walk on her own with no assistance, but she carried a cane for long distances. When she came to meet the patient navigator to do her final testing for the study, she came in swinging her circles like Charlie Chain, swinging her cane like, Charlie Chaplin, just to show how well she could walk on her own. And a quote from Norma, when I came over here, I was on the walker, but now I use the cane because I've been doing the exercise and my bones have been getting stronger. I love Nurse Amy. It helped me a lot. When I do the exercise, it helps with the pain in my legs. I suffer a lot from pain. And the list goes on. There is a pancreatic cancer survivor in Canada by the name of Sydney Hooper, who's an Ironman competitor who is dealing with a recurrence of her disease at this time in her lungs. And she's still going out. She's still posting on social media that she's going out for 3 and 4 mile runs with friends. Susan Helmridge, 3-time survivor. Some of you may remember the DES daughters. And so Susan is a DES daughter. She also has had lung cancer and pancreatic cancer. She is a master's swimmer and a PhD trained epidemiologist to boot. Gabi Grunwald had adenoid cystic carcinoma that was diagnosed in 2011. She was a sponsored ranked USA track and field runner. She placed with cancer 4th in the 1500 at the London Olympic trial. So she just barely missed making the Olympic team with cancer. She was the national champion in the 3,000 meter in 2014. She had a saying over her couch that there were two ways to live your life. The first was as if nothing is a miracle, and the other is as if everything is a miracle. And she certainly embodied the second. Mike Levine was a stage 4 pancreatic cancer patient who had been told to go home and, just wait, that, the end was near. And some friends came and saw that he was withering away and said, why don't you just get on the bike? Why don't you just get on the bike with me? Let's go around the block just for fun, right? And what he found was that was what made him feel most alive. And he got back on the bike, and he actually did one more Ironman before he passed away. Randall is a U.S. gold medalist Olympian. She won gold for cross-country skiing at the Pyeongchang Olympics. And 3 months later, as a young woman, she was already a phenom at the Olympics because she was a young mom. And 3 months after the Olympics, she was diagnosed with an aggressive stage 3 breast cancer. And her training regimen while she was going through cancer treatment was tougher than any training regimen I've ever done in my life without cancer. And she's interviewed in the book, actually, and talks about learning to listen to your body and figuring out the days when you can and the days when you cannot get the exercise done. I do have a new book, and I want to make sure that everybody knows that it's actually not a forthcoming website. I need to change that slide. There's a website that accompanies the book called www.movingthroughcancer.com. If you go onto that website, you can sign up to get 1 year free membership to myvictory.com, which is has been described as Peloton for cancer patients and survivors. It is a library of thousands of YouTube videos that are extremely high quality, extremely high production values, that are safe and wonderful sources for cancer patients and survivors.